Hi everyone. According to my clock, it is now noon, so we're going to get started. I want to start by welcoming all of you to today's webinar. My name is Lindsay Caldflesh. I am a knowledge broker with Gambling Research Exchange, Ontario. And I will let you know that your mics have been muted upon entry to this webinar, and that's just to cut down on background noise during the presentation. So your microphones as listeners will be muted throughout. I would ask that you try to keep your questions for the end. We will then do a question and answer period where we can unmute you one by one to ask questions then. If you have an absolutely burning and contextually important question, feel free to send it to me via the chat function and I will moderate that to the best of my ability throughout the presentation. If you do have a microphone or if you're using a phone, handset, or headset, at the end of the presentation, there's a hand raise function through WebEx where you can virtually raise your hand, and that will let me know that you would like to ask a question verbally to our presenter, and that's how we will do that question answer period at the end. If you have questions about that, again, feel free to send me a question in the chat function. And I think that that's all for housekeeping, so without further ado, I'm going to introduce our presenter. Jessica Tanner completed her master's degree in clinical psychology at Lakehead University and is currently in her 4th year of the clinical psychology PhD program at Lakehead. Her master's thesis examined the relationships between older generational cohorts, gambling beliefs, and problem gambling. For her doctoral dissertation, Jessica is investigating the effects of a gambling information session across the adult lifespan. She is also a research associate with the GRIO-funded Northern Ontario Gambling Research Hub at Lakehead University. Jessica will begin her clinical residency in September at the Northern Ontario Psychology Internship Consortium. So welcome, Jessie.
Thank you, Lindsay. Make some acknowledgments first. So my doctoral research is supported by the Gambling Research Exchange Ontario and has been supported by the Ontario Graduate Scholarships Program and is currently also supported by the Social Sciences and Humanities Research Council. My master's thesis was also supported by GRIO, OGS, and the Canadian Institutes for Health Research. And I'd also like to give a special thanks to my supervisor, Dr. Dwight Mazmanian, and Alex Drawson and Christy Kowach for their help when I wrote the white paper last year in editing and just supporting me throughout this process. So today I'll be talking about the evidence available regarding older adults and gambling through the use of key peer-reviewed articles when available, as well as more recent studies and technical reports. Today's presentation is mainly based on the white paper that I wrote for GRIO last year. But I've also went through and updated some of that research with more recent articles. So specifically, I'll go through available research in relation to older adult gambling activities and motivations, any potential cultural findings, prevalence and risk factors for problem gambling in older adults, any negative health effects of problem gambling, treatment considerations, and potential benefits of recreational gambling in older adults. Before we get started, there are several concepts that we should discuss to practice the information that I will be presenting. And the first one is the definition of older adult, which varies between studies. In today's webinar, the age of older adults range from populations age 50 plus to populations age 65 plus. And related to that, another important caveat to today's findings presented in the webinar is the difference between cohort and age effects. So as you might know, cohorts refer to people who are born within a certain time frame and who are then subject to similar environmental influences. A cohort effect occurs when individuals from a cohort are influenced morally, behaviorally, or otherwise by environmental similarities. And those effects should be relatively stable across the lifespan of those individuals from the same cohort. So while cohorts are then influenced by similar conditions in which individuals are born and exposed throughout their lifetime, age effects then are those that are found regardless of the cohort that's being measured. So a significant effect found within a group of older adults should be the same in another older adult group years later if that effect was a pure age or developmental effect. So distinguishing between age versus cohort effects is not always possible within a single study that has a cross-sectional design, and longitudinal data is then necessary to make those kinds of distinctions. Therefore, many of the studies presented today that present on age effects within cross-sectional samples could actually potentially be due to cohort effects rather than age. Similarly, cohort effects can't be distinguished from age effects without that longitudinal data. So when I talked about the definition of older adults ranging, we can see that 15 years difference could actually put older adults into different cohorts and have an effect in the way that we should be interpreting information. So just keep that in the back of your mind as I present throughout, and I'll bring it up a few times as well. The two most relevant cohorts to today's presentation are baby boomers and the silent generation. So the baby boom cohort includes individuals who are born from 1946 to 1965, usually within the literature. Sometimes that varies a little bit. But there was a rapid increase in the number of births per year during that time frame, in which many Western countries following World War II had a baby boom. And those baby boomers are now in large part responsible for an aging population in Canada and other Western countries. The generation before the baby boomers consisted of a group of individuals usually referred to as the silent generation, and they consist of those who were born between 1925 and 1945, which was times of great economic distress. There was the Great Depression, and born right up until the end of World War II. One way in which baby boomers may differ from the silent generation is in their knowledge of technology. With internet gambling and the blurring of gambling and gaming on the rise, it may actually be that the baby boom cohort is at an increased risk for problem gambling as they enter into retirement, due to that increased accessibility to gambling venues and increased knowledge of technology. Several articles have noted potential differences in gambling behaviors, beliefs, and attitudes between baby boomers and previous generations of older adults, but there's been little study into the area. One study, a review paper by Alberghetti and Collins, posited that baby boomers may have more positive attitudes towards gambling and could be more likely to be motivated by winning large amounts of money than the silent generation. In their review, Thompson and McNeely echoed concern, discussing the increase in accessibility of gambling and citing a study that found increased gambling participation in baby boomers compared to the silent generation. So 80% of baby boomers were found to participate in gambling versus 70% of the silent generation. In my research with my supervisor, during my master's thesis, I did not find differences in attitudes or beliefs about gambling between the two cohorts. However, we did find that the relationship between certain dysfunctional beliefs about gambling had a stronger relationship with problem gambling in baby boomers than in the silent generation. So higher scores on measures of luck and illusion of control over gambling were associated with significantly higher scores on problem gambling measures for baby boomers in comparison with the silent generation. A limitation to consider, though, was that our sample was cross-sectional, so age effects could not be completely disentangled from a potential cohort effect. More research into that area is needed as that baby boomer group moves into retirement and a new stage of life. And just a little fact, Canada has 9.6 billion baby boomers, which constitutes 29% of the total population at the time of that Statistics Canada report. So why is this topic important? I think there are several reasons that we should pay attention to the issue of older adults and gambling. First, as was already mentioned, is the issue of the aging population. We're still not entirely sure how that large group of people moving into older adulthood will change the gambling landscape or affect healthcare resources. And when I refer to healthcare throughout this presentation, I'll also clarify that I do not limit that term to physical health, but also encompassing mental health as well. Another reason why this topic is important is older adults have unique vulnerability factors that correspond with their life stage, which I'll explore in more detail later on as well. The third reason I think this is important is that older adults can be targeted by the gambling industry. through incentives like free transportation, meals, etc. Actually, one study that was recently published by Vandermoss 2017, and I apologize if I mess up any pronunciations of last names, found that in a sample of older adults aged 55 plus in Ontario who frequented bus tours to gambling venues were actually at a greater risk for problem gambling than other gambling venue patrons. So that's a newer study showing that link. And it's also been found that older adults are less likely to seek treatment for mental health issues, including addictions. So in this section, I'll be talking about older adult gambling practices, including their activities, motivations, beliefs, any cultural differences, and the prevalence of problem gambling in this population. So in 2004, Weeb and colleagues found that 73.5% of older adults aged 60 plus in Ontario had gambled within the past year. 58% of the sample participated in the lottery, 47.9% purchased raffle tickets, 23% had played electronic gaming machines, and 19.7% played scratch tickets. And this table is from that report, and it's just giving you a little bit of an idea of how frequent people actually participated in those forms of gambling. So if we look at lottery tickets, which was the #1 form of gambling, 27.6% of the sample participated at least once a week. If we move down to slot machines or VLTs, 23% within the past year. The majority participated, however, less than once a month, 18.7%. So I will note, however, at the time that this study was done, the majority of the older adults in the sample would have been from the silent generation. So I wanted to provide a little bit more recent information by Stitchfield in 2015. So this is an unpublished report. It was a technical report in the gray literature looking at Minnesota older adults. And they found that gambling is higher for baby boomers than for the silent generation, although their silent generation also included the cohort previous. So if we look at any gambling, baby boomers are at 77.1% compared to much lower 60.1% of the silent generation and the older cohort. And baby boomers were also a little bit more likely to participate in gambling activities than younger generations as well. So several studies have examined older adults' motivations for gambling. Typically, the highest endorsed response or reason for gambling is fun or excitement, followed by winning money. And then other self-reported motivations typically include relieving boredom or something to do, socializing, giving to worthy causes such as charitable raffles, and coping with negative emotions. However, as gambling becomes a problem for some individuals, those motivations may actually shift to increasingly include gambling to cope with a negative emotion. But as we know, self-report are subject to biases, including impression management. And there was one newer study that I want to mention by Bailey et al. 2018. So they attempted to measure cognitive mechanisms in responses to gambling on electronic gaming machines in both younger and older adults. So they measured skin conductance responses to wins and losses, as well as losses disguised as wins. They looked at patterns of autonomic arousal through the skin conductance responses and found their findings suggested that younger adults were generally excited by both wins and losses, while older adults showed greater arousal for wins relative to losses. And the authors suggested that this may be indicative of a greater motivation to gamble on electronic gaming machines for monetary gain in older adults compared to younger adults. So younger adults were more generally excited about gambling, and the older adults, they believe, might be more motivated by winning money. So cultural findings with regards to older adults and gambling. Several studies have examined gambling in older adults from a cultural perspective. Lay 2006 found that older Chinese in Canada were more likely to gamble if they were male. If they lived in Canada longer, they had more social support, they had stronger ethnic identity to Chinese culture, as well as if they were more likely to experience barriers to services. The probability of gambling was reduced for that population for those with a post-secondary education and higher and above, as well as higher life satisfaction. Submarinium 2017 looked at responsible gambling in Singaporean past or current regular gamblers that were age 60 plus. And they found two general themes with regards to strategies to gamble responsibly. So there were self-developed strategies and family interventions. There were sub-themes within each type. So within self-developed strategies, that included delayed gratification, the perception of the futility of gambling, setting limits, maintaining balance, help seeking, and the awareness of disordered gambling within the self and others. And family interventions included pleading and threatening, compelling help seeking, and family exclusion orders. Lau and Ferguson conducted a systematic review in 2017, and they examined 18 articles with a total sample combined of over 11,000 culturally diverse older adults aged 55 plus. And they reported that gambling motivations may actually differ in that older culturally diverse or non-Western gamblers may gamble to cope with or reduce depression or anxiety that's caused by trauma of migration and related issues such as employment, family conflict, or low self-esteem due to discrimination or alienation in other forms of entertainment venues. Overall, their review found that early onset of gambling behavior was more frequently found among older adults who belonged to a culture that promoted tolerance of gambling behavior. They also found that gambling was often seen to be an inexpensive form of entertainment while also providing the potential to win money, and was perceived as a potential way to improve quality of life. From that article, the systematic review, they developed a model to represent culturally diverse gambling in older adults. So as you can see, they defined enabling factors here, such as cultural acceptance, socializing, social networks, accessibility. Those were more of a pull or an attraction of culturally diverse older adults to gambling, while these motivational factors over here, such as reducing boredom, loneliness, exercise freedom, or reducing stress, that was more of a push toward gambling. So the enabling factors are more of a pull toward gambling, motivational was more of a push. They also, through their review of the literature, developed buffering factors in their model. So buffers consist of both environmental and personal factors. And personal coping or external interventions then act on the negative gambling consequences right here, personal coping, external intervention. And although the authors did note for external intervention that few studies actually reported culturally diverse older gamblers to seek professional help. So in this section, we'll review the prevalent studies that are available, risk and vulnerability factors, and negative impact on health. So a systematic review by Tesfaye et al. 2012 found reported lifetime prevalence rates of problem or pathological gambling for older adults 50 plus. They ranged from 0.2% to 12.9%. Prevalence rates ranged from 0.3% to 10.4% within the past 12 months. And those wide ranges are likely due to differences in locations across studies, samples, methods, and tools used to collect the data. Rates are also generally found to be higher for older adult males than females. And generally, studies tend to find that prevalence rates for problem gambling are lower for older adults compared to other age groups. In a similar type systematic review, Submarinium et al. 2015 found that lifetime prevalence of gambling disorders for older adults ranged from 0.01% to 10.6% across studies. And they also found that prevalence of gambling disorder was higher among younger older adult age groups than the older adult age groups, and was higher for older adult males and females as well. So generally, prevalence seems to be lower in older adults for problem gambling than other age groups. But there are many risk factors and comorbid problems across gamblers, and there's an argument that there's an increased risk and vulnerability factors specific to older adults. So common comorbid problems or risk factors across gamblers could include more irrational beliefs about gambling, or having comorbid depressive disorders, or problems with alcohol along with gambling. Those are prevalent as well with older adults. However, several factors that are a little more specific to the life stage of the older adult and may increase their risk or vulnerability might include limited financial resources. So there's an argument made in that area. Older adults may live on a fixed income or have less ability to replenish their savings or retirement funds through work. There's a strong argument that older adults then are especially vulnerable for that reason. And they have a limited ability to earn back lost wagers. So if they go to the casino and gamble and lose, they can't pick up a couple of extra shifts to make that money back. Recent statistics have also indicated that older adults are increasingly in debt, with 42.5% reporting debt in 2012 versus 27.4% in 1999. And that represents the highest increase in year-to-year debt compared to any other age group. Secondly, older adults have more free time than they may have expected upon retirement. So individuals tend to plan financially for retirement, but few seem to actually plan for that additional free time that they're going to encounter upon retirement from full-time careers. That's approximated to be 7.7 hours a day of additional time for older adults over 65. So leisure wellness then is important to consider in making the transition into retirement, and individuals who don't plan a healthy and balanced retirement may encounter difficulties like social isolation, boredom, loss of sense of connection or belonging, unhealthy changes in relationships, or even a loss of structure and purpose. Retirement itself may also result in a loss of social networks, contributing to potential loneliness or social isolation. Older adults are also more likely to experience the death of a spouse, family members, or friends than other age groups. They may gamble to help cope with such losses or for the social opportunity that gambling provides. Next, physical limitations or mobility issues may actually prevent older adults from engaging in other activities that they once enjoyed. And so gambling venues are often fairly accessible and provide a form of entertainment that they are able to physically do. So that might be more attractive. And finally, some older adults may have problems with gambling because of brain-related changes. So from the aging process, from medication side effects, or interactions between medications, or even illness, such as dementia or Alzheimer's disease. One study found that older adults with lower scores on a measure of executive functioning had higher levels of problem gambling. So executive functioning is that term used to describe a set of mental processes that influence planning, problem solving, and behavior. So for example, attention, working memory, inhibition, and cognitive flexibility, so the ability to switch between tasks, for example, tasks. And that study also found that gambling problems were related to higher levels of impulsivity, but only for people who had low scores on a cognitive screening tool. So problem gambling in older adults has been found to be related to negative health outcomes. In terms of physical health, that can include more use of medical services, more general health concerns, poor overall health status, higher chronic conditions like heart disease, arthritis, and more obesity-related conditions. And for mental health, that can include higher levels of depression, anxiety and personality disorders, paranoia, loneliness, family and social problems, alcohol problems, and also lower life satisfaction. So what does this mean in terms of treatment? Older adults might have more difficulty in paying off gambling debts, as we talked about earlier, possibly due to limited income. And they may also be more likely to see problem gambling as a financial problem rather than an addiction problem. So financial counseling might be important as a component of treatment for older gamblers as well. There's been little research on the effects of treatment for problem gambling in older adults in general. However, research into treatment for other areas may help understand the effects of treatment for problem gambling. So in the treatment of depression, it's been found that cognitive therapy for older adults was just as effective as with other age groups. And in alcohol research, older adults responded to psychotherapy just as well, if not better, than younger adults, with older adults having a higher rate of abstaining from alcohol 5 years later than did younger adults. It could be that they're more likely to do homework or follow through with treatment than younger age groups. So when older adults do get help, they're likely to do well, but they seek help less frequently than other generations or other age groups. So the benefits of recreational gambling for older adults. I think that this is an area that's sometimes ignored a little bit more, and definitely an area that we need more research into. So recreational non-problem gambling for older adults represents the majority of older adults versus problem gamblers. And for this group, gambling can be a positive activity. So as long as you're not a problem gambler and an older adult, recreational gambling can have benefits. So few studies have actually examined the potential benefits of gambling. Those that have, though, typically suggest that older recreational gamblers have better self-reported health, they have lower depression scores, and they have greater perceived social support compared to older non-gamblers. Researchers have also suggested that some forms of gambling may even help with cognitive functioning, including memory, problem solving, math skills, concentration skills, and hand-eye coordination. That's not necessarily based on any experimental research done. It's more of review papers that tend to report those. So an area, though, that definitely needs more research. For example, Schaefer and Korn, 2002, they posited that gambling can actually help build problem solving and enhance memory. And one study was done by Sobel, 2002, that found that the game of bingo did enhance short-term memory and the concentration in Alzheimer's patients. Limitations to today's presentation and the research available. So as with all research on aging, gambling and aging research is subject to difficulties in differentiating between true age effects versus cohort effects. With baby boomers heading into older adulthood, these differences are even more important to consider. Furthermore, gambling research is in its infancy compared to other addictions research, and therefore the strength and direction of relationships isn't always clear in much of the gambling and aging literature. So for example, does problem gambling cause health problems, or are people with more health problems more likely to gamble, or is it both? More research with greater control and longitudinal data then is needed to clarify those and other relationships. So some recommendations from my review of this topic. For research, we need more research. We need greater experimental control and longitudinal data, and we need to examine the potential cohort effects. versus age effects. For treatment, screening for problem gambling with older adults is very important because they're less likely to present for treatment for problem gambling. So when older adults present for treatment of mental health concerns in general, such as depression, anxiety, or substance use, using a short screener is really important to determine if gambling might also be a problem for them. And this is a chart by DeSay 2012 from their systematic review. And I thought that it was a really good representation of what's needed in research going forward for older adults and gambling. So the first one that they mention is cultural context. So study populations have often been limited to Western culture. We found a few cultural diverse research to present today, a few studies, but not a lot. Instrumentation, so the gambling assessment instruments might not be accurate with the population that they're being used for. They might not be validated for it. So more research into that area is needed. Empirical research, so there's been theoretical assumptions to explain why older adults gamble, but they are often not subject to empirical testing. So we have theoretical models, but we haven't necessarily tested them. Methodology, so most older adult gambling studies have been quantitative, so we need more qualitative studies as well to look at gambling in later life in a more complex way. The gambling literature is also focused on adverse consequences and risk factors for gambling and largely ignores protective factors. So we talked a little bit today about potential benefits to recreational gambling in older adults, but it would also be really important to look at protective factors for individuals who do not go on to develop problem gambling. And finally, most of the studies that have been done so far focus on conventional forms of gambling, but as we know, internet gambling and gambling is becoming a greater issue, and important to also look at it within the older adult age group, and especially as baby boomers continue to age with their increasing knowledge of technology as well. And thank you. I'll open it up for questions.
Great, thank you so much, Jessie. So this is the time for those of you who are tuned in. There is a little hand raise function that you can use to let me know that you would like to ask a question verbally, and if you're having trouble finding that, or if you don't have a microphone to use, you're also welcome to send me a chat directly. I'm going to ask a question, Jessie, just while we see if any other ones are coming in, but do you have any, can you comment at all on, you were talking about how older adults are sometimes less likely to report problem gambling and more to look at it from a financial lens, but for people, when they're participating in gambling like on a casino floor, can you comment on any approaches or language that casino staff could use when approaching them that might be more relevant to what they're looking for?
That's a tough one. I don't know that there's a lot of research looking at that. I think that with older adults, stigma might be more of an issue than with younger adults.
Okay.
So I do think that the language that staff use with older adults is very important. I think that with any person, it's important to have that buy-in. So how is it going to benefit them? So if the benefit is financial, then maybe focusing on that might be better. Or maybe they have other issues that are going on. As we know, problem gambling is rarely on its own. There's often comorbid problems. So it might be that targeting some of those other things would help with problem gambling. So if, let's say, hygiene was an issue, or someone's not sleeping, or they're going through a rough time in their life, then targeting those things versus gambling specifically might create that buy-in for the person. That's all just from off the top of my head, not based on research necessarily.
That's okay, thank you. So Richard has his hand raised. I'm going to see if I can unmute you. Richard, are you able to ask your question verbally? I don't hear anything. So that's okay because I have it right here. Richard said, thanks for the great summary. We found some of the references really useful. Will presentation be available afterward? And Jesse, you and I chatted about this. You are comfortable with me sharing your slides afterward, correct?
Definitely, yes.
Perfect. And Sean asked, is there a specific gambling screener for older adults that is commonly used?
I don't believe I've come across a specific gambling screener for older adults, but I would definitely look into that for you.
I've unmuted.
Oh, yeah, sorry.
Sean, do you have anything you'd like to add to that?
No, so I am a gambling counselor, and we do use like the DSM-5 criteria and the SOGs, and certainly ask older adults to present with substance use disorder if they have a gambling or gaming concern. But I'm just wondering, in the course of your research, if you found anything that would be more beneficial.
No, I don't believe that I have. There is a later life gambling measure, but it's not necessarily a screener. There are very short screeners, though. Like there's the brief biosocial gambling screen that could be used. Let's say if you had just a client presenting with depression or anxiety that you could use. It's 3 questions long. It's not necessarily specific to older adults, but it's nice and short. I'm going to look more into that, though. I haven't seen anything for sure, but I'll do a specific search for it.
Thank you.
You're welcome.
Thanks, Sean. I have a question from Jasmine. Jasmine asks, can you expand a little bit about the positive effects of gambling for older adults and or the protective factors? And then she says, definitely haven't seen as much of work on that topic, and as a regulator, I appreciate the more balanced approach to future research.
I think that it's definitely something that's a little bit ignored sometimes. Most studies on the topic have found that social support is motivation for gambling in older adults, but also a benefit, especially if it's more of a group gambling setting, so things like bingo or something like that, that are more group-oriented, or people who go on gambling buses with friends and things, although we know that gambling bus might also be related to problem gambling. So there hasn't been a ton of research in that area, but let me just flip to that, my notes on that.
Actually, can I ask a quick question that Jackie sent me that is actually directly related? She says, do we know of anyone, I'm looking at a very small window here. Do we know of anyone targeting or intervening specifically around seniors, buildings, or bus charters to provide problem gambling support? Bus charters have taken over, she says.
I don't know of anyone targeting that. I haven't heard anything like that.
Okay.
It's something I've thought about, though. It's actually why I got involved in gambling research. Was I lived in North Bay, and I took a casino bus to Casino Rama.
Oh.
And I would go maybe once every couple of months, and it was the same older adults on the bus, and it got me thinking. And that's how I got into gambling research.
That's really interesting.
Yeah. And the older adults on the bus, this is all anecdotal, obviously, but the older adults on the bus were very jovial and joking around with each other. They brought snacks for each other. They went and visited with other people on the bus. So when I'm picturing social, that's completely social. And I could see those older adults would benefit from that, but I don't know how many people on the bus, had problems with gambling or anything like that.
Right. Interesting.
Yeah.
I am going, do you have more you want to add? We have a couple other hands raised too.
Sure. I was just going to add with the benefits of gambling. Like I said, so some of that cognitive functioning stuff that I talked about is more theoretical. It hasn't been tested, so we don't know for sure what those benefits might be. We'll leave it at that.
Okay. So Sylvia has been waiting with a hand raised for a second. Sylvia, are you able to talk through a mic?
Yes.
Okay, go ahead.
Thank you. Thank you for your presentation. I was very happy to hear that this whole presentation about the cohort and age effects and how we need to disentangle their mutual effect and respective effects. However, I have a question about how would you address the issue of period? Because in many instances, the age, cohort, and period effects tend to cover eye, and in the gambling, the gambling context, the period is extremely important, given the change in the offering of gambling, the gambling markets, social norms, etc. So I don't know if you have any thoughts about that.
Yeah, that's a really interesting question. And when I was preparing my presentation, I thought briefly about it. I don't know a ton about period effects, but I would imagine that we're in a huge period effect right now. I mean, gambling technology is changing so quickly, and it's affecting all age groups, all cohorts. Gambling, now versus 50 years ago is completely different. So I think, I definitely also think that it's important to acknowledge that all of those things interact. So age groups and cohort effects and period effects can all interact with each other. So it might not be possible to disentangle, this as a pure age effect, or this is a pure cohort effect, or this is a pure period effect. But I think it's important to consider all three of those for sure going forward in gambling research and across all research.
Yeah, thank you.
Thank you. And just for those of you who have asked a question and have had your question answered, if you don't mind putting your hand virtually down, so I know that you're not waiting for another one, that would be helpful. The next person who had their hand raised was Michelle, so I'm going to unmute her mic. Go ahead, Michelle. I don't know if I can hear her, actually. All right, Michelle, let me know. And I will unmute Sarah List. Sarah, are you there?
Hi, yeah. Thanks, Jesse, for the great presentation. I just wanted to respond to the question about intervening with the bus tours piece, and just wanted to say that there are marketing and advertising standards in place that are in compliance with the Alcohol and Gaming Commission standards for marketing. And so any advertising and marketing that's done for these tours and whatnot is in compliance with those regulatory standards. So hopefully that helps answer, I believe it was Jackie's question.
Thanks, Sarah. Do you know what standards are in place for that? Like, do they have to have brochures or anything available?
I'm not 100% certain of what the actual standards are. Maybe if the regulatory individual is available, but they might know better. I do know that there's a number of assessment tools that OLG has specifically about how to certain compliance measures that are required for marketing, depending on what the actual advertising is and what it's for. And there's significant training that's put into that as well. So I don't know what the, if there's requirements around specific materials that are in place. There might be, it just depends on, I think, what specific pieces is being advertised. But again, at the site, I would say all of our PlaceSmart information, brochures, PlaceSmart centers are available to customers that are attending those locations. So if it's not available directly on the bus itself, it's available in the gambling environment.
Okay, good. Thank you.
Thanks, Sarah.
I will add to that also that people, so I'm in Northern Ontario, so my context is a little different. There's more gambling venues in Southern Ontario, but in Northern Ontario, it's a little more far and few between. So Thunder Bay has a casino, but I know that there are bus tours into Minnesota, and I know too that living more towards the Manitoba border, people in Kenora sometimes bus over to Manitoba, or people in Fort Frances busing into the United States as well. So I think that it's interesting too that even though within Ontario we have these regulations, but we know that there are people going outside of Ontario as well to gamble. I don't know also what those what resources are available in that regard.
Small shameless Grio plug, if any of you who are interested in doing work like that are in Ontario, that's like the creation of some sort of knowledge translation tool to educate older adults about gambling harms would be definitely something we could partner on and put some funding towards. So connect with me. I'm Lindsay. So I see Michelle's question, and I'll get back to that in one moment. I'd just like to move on to Isabel. She's been waiting with a question for a little while. Go ahead, Isabel.
I just sent a few comments. So I was just saying that in Montreal, well, in Quebec casinos, we have more females, like elderly females, registering for the self-exclusion program than younger than the males. So we have like 2017, 2018, we had like 53% of 18-35 males compared to, I think it was like 26% of 30 to 50-year-old and 36% of 51 or 31 to 55-year-old female. So maybe registering for self-exclusion is different. Of course, it is different than asking for or going out and reaching out for treatment. But we do have a fairly higher number of females asking for self-exclusion, which is the first step for, I guess, if not treatment, like stopping the negative consequences.
That's really interesting. Thank you for sharing that.
Yeah, and as well as I was just saying that you were, like, for elderly people, going to a gambling venue, like a big casinos, or it's a very safe environment. They know their security. They know if they're not feeling well, if they're worried, or anything. If they don't feel like, if they physically are not feeling well, somebody will take care of them. So that, I think it's one of the reasons as well that they like to go to those places.
Yeah, definitely makes sense. It's a familiar environment.
It is, whereas they can always find a friend or a smiling face.
Thanks
for sharing that.
Okay.
Michelle asked, which types of gambling activities in particular helped with hand-eye coordination and other positive skills or outcomes?
I tried to look into that before the talk, and the article doesn't say, unfortunately, because I was also interested in how gambling might help hand-eye coordination. But thinking about it, I was thinking maybe this might be less relevant now because we don't maybe use bingo dabbers so much, but I was thinking with bingo dabbing, maybe that might be a little hand-eye coordination, or, yeah, I don't know. I wish that I had that answer. I'm sorry.
That's totally fine. If you learn anything, or Michelle, if you know of anything, maybe the two of you can connect. I'll be sure to pass along slides and contact info for Jessie following the presentation. So I don't see any new hands raised, and I don't see any new chats and Q&As, so I think I'm going to cut it there. Jessie, thank you so much. Obviously, that was very engaging. The audience was really excited to ask you questions and chat about that, and I love to see that. So thank you so much for your presentation.
Oh, thank you.
As we chatted about, I will pass along Jessie's slides as well as her contact info so you can follow up with any questions if you have any. And we have also recorded this webinar, and we will post that and send it out to any of you who were registered through our initial email earlier. So you can share it with your colleagues or rewatch pieces you missed or whatever you need to do. And that's all from me. So thank you so much.
Oh, thank you.
Thanks to everyone who tuned in.
Bye now.
Bye.